So my name is Varuna Aluvihare. I'm a consultant transplant hepatologist at King's College Hospital. So we're a large transplant unit. So we do, last year we did 230 transplants in total. Around 180 of those were in adults and the rest are in children. And I think this year we're projected to do even more. Well, there was a report recently that suggests that liver disease is growing exponentially in the UK, probably at a rate higher than most comparable countries with similar economies in Europe and the Western world. The difference, certainly in the data that I've seen from ELTR, suggests that really from around 3 months, but certainly out to a year, you see differences in patient and graft, that's the liver transplant, survival emerging between what we would regard as standard of care, that's twice daily tacrolimus, and the Advagraf group. So tacrolimus is the drug, the active drug for all of the frontline immunosuppression that all solid organ transplants use, not just liver transplantation. Advagraf is modified so that it's released in a much slower form throughout your gut rather than just at the top end of your gut, if you like, which is much sooner. And as a result, you get a much more gentle 24-hour exposure rather than having to take it twice to keep the levels up throughout the day. Because of course you need the drug to be active throughout the day to stop rejection. I think it is an exciting period in liver transplantation, and I think for all solid organ transplants, advances in immunosuppression have historically always led to improved outcomes, which is obviously the thing we all want to deliver for patients. So clearly, if we find another generation of products that are better and make patients live longer, that's going to be very exciting. All the basic immunosuppression we've relied on has relied on a twice daily regimen of tacrolimus because that's the standard of care. The big difference with Advagraf that is the once daily drug, which is only taken in the morning, that massively simplifies a patient's lifestyle and ability to take the drug and live a normal life, frankly, which is what we're trying to do. On top of which, it may be that the way the drug performs may be beneficial beyond just patients adhering to it regularly.